Hi, everyone. It's really an honor to be here today. Thank you so much for the opportunity. My name is Jennifer Emenim, and I am the director of Dr. Ibe's Locks. I am here today on behalf of Dr. Ibuku Odutola, who is a psychiatric nurse practitioner. She is the founder and CEO of Dr. Ibe's Locks, as well as the CEO of Victory Health Solutions. So, a little background about Dr. Ibe's Locks, as we like to call it, deal. We're the real deal. Deal is a self-care platform that was created specifically for healthcare professionals, dedicated to eradicating burnout in the healthcare industry, as well as decrease the rate of suicide. Because we know that the healthcare industry, there's a lot of burnout, and sadly we have had some providers, a lot of providers who have passed by suicide. So DEAL was actually created to, help prevent burnout. And as an organization, we pride ourselves with being that buddy that, helps spread love to healthcare professionals, help them feel valued, appreciated for the hard work that they do in the healthcare industry. So, like I said, a little background of how DIL started DEAL. So we know that during the pandemic, mental health crisis was at an all-time high. And at that time, Victory Health Solutions played a huge role to help combat that crisis. But unfortunately, at that same time, we had a huge amount of healthcare professionals who were leaving the field, not because they did not love what they do. We know that a lot of us here love what we do. It's just that we're burnt out. Mentally, physically, the burnout is real. And so in order to combat this crisis, Dr. Odutola, together with her team, created a platform specifically for healthcare professionals to help them maintain, their mental health and, their well-being. So with this organization, we provide tools, we provide resources for healthcare professionals to go to help them cope with the stress of the environment that they find themselves in. So apart from the tools that we have online, we actually do have wellness sessions, on-site wellness sessions where we come to help the employees, we teach them practical strategies that they can use in their everyday life, to cope in the healthcare industry. So, and then these strategies also serve as, also serve as employment retention strategies, because if an employer is willing to take the time to invest in my mental health, in my well-being, that's an employer that I definitely want to stick with, right? Because sometimes when you wait, mental health versus more money, I really would take mental health first. I'm all about protecting my mental health at this point. So DEAL is a platform, like I said, that provides that safe environment for healthcare professionals to feel heard, to feel valued. A lot of us feel stressed in our jobs. Some of us are depressed, or we just feel isolated. We don't have who to talk to. And part of the reason is because of the stigma associated with mental health. As providers, we are the ones that take care of the patients. But imagine when the role is switched, right? It's difficult for you to come out and ask for help. So DEAL provides that safe environment where you can come without feeling judged, without that stigma associated with mental health. So before I leave you today, I have 5 trivia questions. And we also have gifts. We're not called the happiness doctors for no reason. We have gifts. Yeah, we do have gifts. So first question, what is one of the leading professional factors contributing to suicide amongst doctors and nurses? There we go. And then second question, which barrier often prevents healthcare professionals from seeking mental health support? Thank you. And then third question, doctors are more likely than the general population to use which method in suicide attempt? And then fourth question, what is one evidence-based strategy hospitals can use to reduce suicide rates among staff? And fifth question, on an individual level, which daily practice helps nurses and doctors build resilience and lower suicide risk? Thank you. So I do urge you all to get on our website, and we have free tools that you can use to just help you in your daily career. I know that, like I said, healthcare is stressful enough, so we do have free tools that can help you. Thank you so much for listening today.